Hello, everyone. Welcome back again to the show with me, Mary Apollo. We today the Ministry of Health in South Africa, Zweli Mkhize, he announced that there is a new cases of 12,000 to 1219 who are affected by coronavirus, and there is 233 deaths up to the date. And they announced the western part as a Clastur outbreak. So there is still a lot of challenges, but the government are working to make the situation get better and trying to provide with health facilities to different villages. So I have a special guest with me today, Zaineb. Welcome, Zaineb.
Thank you, Mary. Thank you. I'm glad to be here.
Welcome, me too. So she's a research assistant at the University of Pretoria, and she's majorly in academic. So Zainab, just up this figure, 12,000 to 219 cases up to today. And the Ministry of Health are working on new strategies. How do you read it from your perspective? What is the citizen are facing? Is there fear from the public?
Okay, so when we hear of cases increasing every day, the normal thing is for us to have fear of like, okay, how long do we have to wait indoor for these cases to reduce, or to what extent should we then be culpable for the increase in cases? Because the lockdown was in full force until the 1st of May, when the government then reduced it to level 4. Level 4 has some sort of easing to the lockdown where people are allowed to order food online. So therefore, restaurants are allowed to open, subject to just deliveries. But on the 1st of May, what we saw, particularly in the Western Cape of South Africa, was flocks of people going out for workout. So when we then see this kind of scenario where just in a day, a lot of people went out, not because they needed essential services or medical services, but because they felt the need to work out, we then see a situation where the citizens are not really helping the government fight this pandemic.
Mm-hmm.
And we can then say the increase in cases that we are seeing now is the consequence of what happened when the government reduced the lockdown from level 5 to level 4. But that doesn't necessarily mean government easing the lockdown is a bad strategy. It just means that the citizens were unable to properly utilize the opportunity provided by the government.
Mm-hmm. So I go to this point of like as May 1st, when they start opening a store, because there was a lot of challenges after the 5 weeks of lockdown and the economy was going down. Was it an opportunity for most of the people who lost their job and didn't have income and source of assistance?
So like the easing of even before easing of the lockdown, the government already put in place like measures to assist people
Mm-hmm.
that would likely lose their job from the lockdown. We had the COVID Solidarity Fund, the president announced in one of his State of Nation, in one of his addresses. These solidarity funds, billions of rands was donated to these funds, and different measures were put in place for the distribution of this fund, because they have to make sure it's the people that need the money that they give to, not the people that already have enough. So therefore, there is also the COVID relief, where 350 rand is also given to households that really, really need them. So even before easing of the lockdown, people that are likely to lose their job from staying at home were already within the quota of the people that government catered for by establishing the Solidarity Fund. So even after easing of the lockdown, this Solidarity Fund continues. So people then trying to exploit the easing of the lockdown in the name of, okay, I'm likely to lose my job, is not enough justification. Because we are talking of the protection of public health now. Everyone needs to obey government's directive. And insofar government, as to an extent, puts in place strategies to minimize financial problems among citizens, then I think citizens should also help the government.
So, like what is happening in Western Cape, they announced the Clastur outbreak, and actually there is 7,235 cases in the Western Cape and 2,573 recover. So I think in the clusteratic outbreak cases, the disease is transferred from the people, either from the person to another person, or either from the person to a group of people. Just let me know, explain to me, how does it reach that level? From
the coronavirus cases in Western Cape?
Yeah, like
so this is what happened in Western Cape.
Outbreak, like it moved from person to another one. Because
okay, continue.
They just haven't give us an enough explanation for how it happened, but they just say that, like, if there is someone who is infected and he went to the group of people and he give those people get infected by him, why does it like influence the population that much quickly? Why they didn't control it that time? Why did the government didn't manage to control it?
So, I earlier talked about how, like, on the 1st of May, a lot of people went out when government eased lockdown. The Western Cape was the most culpable of breaking every regulation and every directive regarding the lockdown. When on the 1st of May, more than like 1,000 people were seen in the same location in the Western Cape. Now, imagine if one person is infected with, let's say, a communicable or a transferable disease. The likelihood that the people are within the proximity of such person getting that disease is high, which is why presently now the Western Cape has been tagged as a hot area for the COVID-19 in South Africa. So other diseases in such area are likely to enjoy the same high rates of transmission. So Western Cape presently now is not seen favorable by the government. And 2 days ago, the president gave an address on the likelihood that they are going to ease the lockdown from level 4 to level 3, but are going to maintain high regulation for the Western Cape. And that is because people are not following the stay at home, only go out when you need something necessary in the Western Cape. And that is a problem for the larger country. Okay,
so I'm going to go to the educational sector. As we know, since the May 1st, and then the 1st of March, when the first case was announced in the country, there was a lot of, most of the higher education institution get disrupted by the decision. And we know that we have like 90, as UNESCO said, there is 9.8 million African experiencing disruption by the COVID-19. And we are talking in a place only when we have 24% of the population have access to internet. And right now, students are still in the lockdown and they don't have access to education. So how did that concern the educational sector?
So education, particularly in Africa, is always contact based, where students and lecturers are in the same room, and the need for physical interaction. Also, the level of technological advancement is also a problem when we look at South Africa, for example, as an African country. COVID-19 is a viral infection that can be curbed when physical interaction is restricted. And that impacts on how higher education can flourish. So on the 16th of March, majority of universities in South Africa closed down their gates and advised their students to stay indoors. But leading up to the lockdown, universities advise their students to go home rather than stay around campus because they don't have the capacity to cater for them.
Mm-hmm.
And a lockdown is not a situation where you can still go to class. It's a situation where nothing is happening, nobody's going to work. And how this invariably impacts on the method of learning is then universities and other educational institutions having to then technologize and find new ways of learning rather than the physical interaction they've been used to. This then creates a problem when universities have to then look inward to make use of virtual learning as a way to improvise what COVID-19 has restricted them to. But how this virtual learning is then a problem is virtual learning is only possible in a society with high level of technological advancement and internet access.
Mm-hmm.
Majority of students in South Africa are from less privileged or Black families with, like low income variation.
Yeah.
Now, what the universities are doing is then to try to get laptops to students in their homes,
Mm-hmm.
provide free data for them to aid learning, and also transfer learning to the virtual space and make it conducive, considering the various mental health problems that students are going through presently. But how that become a problem is how many students
Mm-hmm.
can the universities provide laptops for?
Mm-hmm.
To what extent can the very advanced content universities teach be given within a free data network? So even with the zero-rated data that most of the service providers are providing in SA for university students, it is still not enough because we find out students cannot access some sites because data is needed for access. And some students have not yet gotten laptop, therefore learning is impeded.
Mm-hmm.
These are a lot of issues, and looking at COVID as just a mere health problem would be myopic because it transcends into the academic space where we then have to rethink how we teach and the inclusion of as much students as possible into the new method of learning.
Mm-hmm. So how do you see that as a challenge for you as a researcher or on the education?
So as a researcher now, when, like for instance, when you are writing a paper or for a journal, most of the materials that you need are in the library.
Mm-hmm.
Little materials are online.
Mm-hmm.
You need some materials that are in the library and you cannot go to the library. So the level or the quality of your paper is already restricted by the level of materials you can access.
Mm-hmm.
Because the internet, as much as it contains information and reference materials, there are some primary data that you still need either by going to the library or by conducting interviews, administering questionnaires, and all of that. And also, some students during the lockdown, before going home, left most of their study materials in school in the hopes that, okay, the lockdown is going to end soon.
Mm-hmm.
But now students are having to then only learn with the limited materials they can access online, which then creates a problem for full actualization of learning and also like understanding of this, what they are being taught without adequate reference materials, which also extends to researchers like myself and also people writing their dissertations and their research projects.
Okay, do you see it as a new way for Africa to develop the advanced sector of researcher to the future reference?
Yes, so I feel like this period should be a period of introspection for African leaders, and particularly the area of IT and technology. Because even though COVID is affecting the world, when we look at the educational system of most advanced countries, they are really suffering less than we are suffering because they've created structures that would aid this sort of situation when it happens, like internet access and access to devices. But when we, in Africa, we don't focus on such problems. So this COVID period is a period for us to introspect and really engage in ways to further virtual learning. And this is the period we can do that, because the moment this COVID ends and we can start physical interaction, people are going to forget until, God forbid, another viral infection happens again. So this is the period the African leaders and every stakeholder involved needs to engage in introspection on how we can develop our technology sector and also our IT sector to cater for this sort of unforeseen and unprecedented pandemics in our society.
Okay, so the president announced yesterday that they are going to implement the lockdown to level 3, based in some states like Cape Town, Johannesburg, Durban, and Nelson Mandela Bay. How that is going to help the situation get better, and how the government can use the reliable resources that they have and the infrastructure to make the situation better.
So when the government says they are going to ease the lockdown, it is not because there are no cases. One realization governments all over the world should come to is that we will have to live with coronavirus for some period of time. But our ability to be able to live our normal lives with this virus goes a long way, which is why the government is easing the lockdown to level 3. Because if we continue being on lockdown on level 4, level 5, the economy is going to crumble. People are going to lose their jobs. Countries will have to restructure. On the negative side, that's laying off people and trying to balance their profits and losses. So therefore, I feel on my side, it is a wise decision for the government to ease the lockdown, but necessary measures need to be put in place to make sure this easing of lockdown is not abused like we saw in Cape Town on the 1st of May. Because if abuse of this easing continues, then stricter measures and level 5 lockdown would have to be implemented again.
And is that taking you to where the people protest? Most of the immigrants went out to the street and they have been attacked by the police. And I think there is an amount of 300 people are seeking shelter in churches. How is that related to the human right violation? And what message you send as a researcher for the government to come?
So you see, the whole idea of a lockdown is in contravention to the liberal ideology of freedom of movement, freedom of expression, citizens' rights. So when issues of public health, national security, public order happen, they take precedence over individual rights. But that doesn't mean that we see perpetuation of people's rights being violated. It doesn't justify police officers continuously abusing and violating people on the streets, right? So these people protesting and people clamoring are normal response the government should expect from people that you say, okay, you can't buy alcohol, you can't go to restaurants. I mean, these are like normal things because people are used to this way of life. Then one person comes and say, no, you can't do this for a period of 49 days. That creates a problem. One way or the other, people would have to disagree with you. There is so much an individual can take at a time, right? Which is why, as much as, yes, government needs to enforce public order, there needs to be a dilution with understanding to this. You can't just, start jailing people, beating them, killing them in the name of enforcing public order, because you are enforcing public order for the safety of these people. So you then have to put into consideration, these are the people we are trying to ensure order for them. How do we then make them understand the dangers they are in without necessarily inflicting dangers on them too?
So in case the implementation of the new strategy by the Ministry of Health, they're going to distribute the health facilities in some villages. which has nurses. They were going to be a screenshot and quarantine for some of the affected people. You think that is a new way to make the situation better for the upcoming weeks?
I think when we look at the trajectory of what has been happening before, is that government says everyone stays at home so we can test people and then curb level of transmission, which is like a top-down approach to solving transmission. But what government is now doing is, let's go to these people. More like a bottom-up approach. Let's go to them and tackle this problem from the inside. Because when you say everyone stay indoor, yes, it prevents a lot of transmission, but it really still doesn't solve the problem from the inside. Like when you then go into the villages and attack this virus from inside by making sure people wear their face masks, by putting in health facilities there that can easily test them and also teach them about how to prevent, this infection. And in case where they find themselves having some of these symptoms, what they can do.
Yeah.
So there is a difference between when you put in a blanket strategy to fight a virus and when you put a detailed and more bottom-up strategy to fight the virus. I think what we need now, having, tried the lockdown and we still see cases increasing, what we need is a new strategy, which I think what the Ministry of Health is doing is trying that.
Okay. So during this lockdown, they say they were they managed to screen some people, like 10 million people, and 400,000 cases test. Do you see that as a new way of the government will be holding this situation on the upcoming period of time?
I think South Africa has been really impressive when it comes to testing population. I mean, among African countries, it has one of the highest cases being tested, which is a good thing, right? And I think that shouldn't stop. Testing brings out more cases. Realization of more cases gives us what to do going forward. But because we are going to ease lockdown, we feel, we should reduce testing and only focus on cure, then that also creates a problem. We should continue the flow of testing a lot and add new strategies like going into township and villages to tackle this virus firsthand. Then all these strategies together would create a favorable result.
Okay, you mentioned earlier the point of education, civic education, and they should reach all those people under the ground to teach them about what they should do. What do you think youth should do together to be part of this this movement, or younger women who are the most affected population in the community?
So when we speak of like the population of women and the section of women and how they can be involved in this COVID issue. So when lockdown started, in the first week, issues of gender abuse, sexual abuse recorded 87,000 cases. You can imagine how within a week, a lot of gender sexual violence against women are being perpetrated. And that creates like a problem because we are trying to run away from virus outside, but we are met with another problem as women inside, which the government was then able, from clamors from like people, government then put in measures to cater for this section of the population. And myself as a person, I'm quite vocal on Twitter. So like I air my views, and even though I'm a foreign national in this country, I try to at least get happening, and our knowledge of what is happening then gives us idea of what we can do. So as women, I also like encourage women, when you are going through mental health problems, sexual abuse, and you cannot tell obviously the person that is perpetrating it to stop, find a confidant, call this helpline to report these cases, and then help will come. And myself being someone that is in the academic space, I try to engage with people and check in on them within my own capacity. Are you fine? How are you doing? hope you are not going through any sort of difficulty. Those little things go a long way in making sure people feel safe in an unsafe space. And I've enjoying other women to do that, and not limited to women, like the general population, to check in on people, because this lockdown can easily translate into something else for an individual that probably doesn't have a good hold on their mental health. And that is really important in this COVID era, where we have to stay indoor and we are only limited to the four walls of our room. A lot of things can happen, and checking in on people goes a long way to make them feel safe.
Thank you, Zaineb.
Thank you.
For joining me. And thank you. This was Zaineb with me. She's a researcher at the University of Pretoria, South Africa. We talk about the general situation in South Africa, and still there is 2,219 cases up to today, and the deaths of 238 people. And the government are implementing a new strategy for the lockdown to help the situation improve in the western part. Until we meet again, thank you.
Thank you.